First slide I want to show you is just the slide I like to talk about, and basically the price of inaction. In the last several years, healthcare has doubled, but also it is clear that within the healthcare program that you all pay for now, if you're insured, a sizable amount of that is currently paying for the uninsured, about $1,900. The other thing that Steve mentioned, about 20% of our population is uninsured, about 133,000 Alaskans today have no insurance. This number actually has grown since my last forms in June from about 116,000. So the number has grown over the last few months here. The next one. This is, again, just some statistical data, and it's not just, someone in Washington, D.C. and a bunch of bureaucrats coming up with this. This is a lot of research done by private sector research, as well as universities and others, and they estimate over the next 6-7 years, it's clear that healthcare costs will double again. Right now, we pay on average around $12,000 for a premium, and it will double to about $24,000. But it gives you just a sense of some other data points that I think are important as we discuss tonight. This is the one I mentioned at the opening. Next slide. There we go. Those that are insured, we have the highest amount that the insured pay for the uninsured in the country. One of the highest amounts, $1,900. Pretty significant. Those are the people that don't have insurance. They wait until a crisis occurs. They show up at the emergency room, and when they end up getting that coverage and can't pay for it, that cost is shared by the insured, as well as the people who may not have insurance but pay cash for what they're doing. That cost is split and shared among the rest of the folks. Next slide. This is one that just, again, is just some general data that I think is important. 18% of our GDP now is healthcare. They estimate that to continue to go up, as you see, up to almost 32-34% by 2040. A sizable amount of our economy will be consumed by healthcare expenses. The other one, which has had a lot of discussion, and there are 5 different bills plus some other what I call secondary bills. There's 3 on the House side. There's 1 that's passed the Senate Committee of Health, Education, Labor, Pension, and the second bill is still in discussion in the Finance Committee. That's what they call the Baucus bill. The $800 billion number that you hear all the time is over 10 years, approximately $80 billion a year, and the bill currently is deficit neutral with actually a deficit surplus in its first year of around $50 billion, and then the second year of around, or the second 10 years, significant more. I just turned this other mic off, so I don't know if the tech people caught that. The next slide. Again, this is just another statistic that we did in regards to small business. One of the areas that we are highly focused on, this is out of an MIT study, trying to figure out what the impact is for small business. Small business in Alaska employs 52% of the folks employed in this state. They are a significant part of our employment, one of the highest percentages, again, in the country that drive the economy. So as we move through this agenda on healthcare, small business has to be on the forefront of how to get access, how to make sure it's affordable, and making sure that the small business community has the right incentives. And this just shows you a cumulative cost, again, of doing nothing with regards to healthcare. It is estimated by MIT, if we do just kind of a mid-range proposal they have suggested, over the 10 years, it will save approximately $800 billion for small business. And that's in the mid-frame. The next slide I want to put up, and there's a variety of ideas that I support and other people are talking about in regards to how to manage healthcare costs and reduce costs or find savings. The two that I actually just point out, and I'll end on the number 6 there, but number 5 is one that I like to bring up quite a bit, and that is the whole issue of technology and the impact that technology will have with medical coverage, as well as how it will be more efficient. Think about this, and I use my own medical experiences. When I go to the dentist, I'm sitting in a chair before they put me under, trying to pay attention to everything they're doing, and then I remember back 10 years ago, or even sooner than that, they bring in the x-rays, they put them on the wall, and they look at the teeth, and then they go out and the scheduler will come in to get your next appointment. All that now, here in Anchorage, my dentist, it's all digitized. Everything's right there. you're sitting in the same chair, maybe that's the way they do it. No offense to dentists here, but maybe that's because you're on Novocaine, so yeah, I'll take 2 more appointments, whatever, take care of this tooth. But it's all right there because they use medical technology to make their systems more efficient. About 10% of the medical professionals outside of the dentistry and other specialties like that are using technology. So they're not even using it at the peak level. But the last one, number 6, is one that just drives me crazy, to be very frank with you. In 2003, Congress passed a law that prohibited Medicare to negotiate the lowest cost prescription drugs for Medicare recipients. VA, on the other hand, negotiates. They get the lowest cost. And the net cost to us as taxpayers is $106 billion, just in Medicare, because we don't have the right to negotiate. And in a report that I was just going through recently, I pulled out a document and it was comparing Medicare and VA. For the top 25%, or for the top 15 items that Medicare purchases, which consumes 25% of the prescriptions and wheelchairs and all the variety of things, the differential between Medicare, exact same thing that you buy in Medicare, versus VA is almost double. The exact same thing. The difference is because we are prohibited from negotiating by legislative action. I think that should be changed. I think when you see this kind of savings, it's huge, huge. $106 billion. And there was a vote in the Senate Finance Committee, and this item failed. And it failed on a split vote, bipartisan. It had 3 Democrats and all the rest were Republicans. And they voted no on it. There's a group of us, bipartisan, that are going to bring it up on the floor and win it if the bill gets up, because I think this is a significant change, savings, and the bottom line is there's no reason why we can't negotiate like the VA, because the bottom line, the same people are paying the bills. So that's, I always like to leave on that note. Last item, this is just, and we'll leave, I don't know where Bruce is, I may ask you to leave this up for a little bit, and I may have you come back and put that other slide up at a local point. But this is kind of where we are right now on several of these items that I hear about from people, pre-existing, out-of-pocket expenses. What's the issue of the uninsured? The issue of how do you make sure if you lose your job, how to get access. This is the status quo, as you see, very simple, and included in the reform, and you notice that bills, it's not bill, there's several, so there's bits and pieces from each one. And the goal is, at least in my perspective, many of these things I support. I want to see lifetime caps taken off. I want to see less out-of-pocket expenses by an individual. I want to see pre-existing conditions covered. And I think us continuing to pick up the uninsured within our insured packet of $1,900 is unacceptable. But every bill has a little bit of each one of these. And so that's, I just want to leave that up so you get a sense. Steve, what I'm going to do is say a couple more comments. I'm going to turn it back to you, right? And I want to put a little perspective around all this, and I'm hoping the tech guys, I know that echo is really bad, I'm going to keep trying to adjust that there. The bills that are in front of us, there's no bill on the floor. Let me make that very clear to you. There's no bill in front of the Senate on the floor to vote on at this time. There's one bill still being worked on in the Finance Committee. They have over 500 amendments they're going through. And it's all kinds of stuff. And so they're working through that. The House side has 3 bills. They're busy trying to figure out how to merge all those and make it into something. When the process goes forward, the Senate Finance Committee will finish their bill. The Health Committee, which is Senate Finance and Senate Health Bill, will come forward. They'll merge them into something. We don't know what the final product is yet. That's what will end up on the floor. That's what will be discussed if it gets to the floor. So that's the lay of the land. So when I have people who call and say, don't vote on that bill, there are many bills floating, and many ideas that are floating. And what's happening today will change tomorrow in the sense, for example, the issue I mentioned just here on Medicare. I think there's a lot of votes to change that and make sure we can negotiate. But it's a process that's, it's not the prettiest sight, I can tell you that, to watch. But at the end of the day, there will be probably some health care reform and health insurance reform of some sort. Let me end there. And Steve?
Terrific. Okay, let me just review again real quickly. I'm going to ask you to raise your hand and I will do my best to recognize as many as we possibly can. I'm going to move around the room. I'll try to get a great cross-section of the crowd. Just give me 30 seconds here, and then we'll get back to you. And I will recognize you, and then we'll have someone with a microphone come over into the aisle nearest you. You will, if you're not at the aisle, you'll need to kind of move into the aisle a little bit to make your comment. Now, my job here tonight is to be the bad guy. Each questioner has 2 minutes for a comment and a question. And what I'll do is sort of sit back when you start your remarks. And after about 1 minute and 30 seconds, I'll stand up and hopefully catch your attention so that you can wrap up your remarks. After 2 minutes, it's my unfortunate duty to try to cut you off and let the senator respond. So I'm going to ask you to kind of follow the cues and stick to the time limit so that more people can get a chance to ask their question or make their comment. Last thing is that the staff members will have the microphones here along the aisle, so remember that. All right, so hands in the air.
Steve, you have to remind, there are still seats over here.
That's right.
For people who are walking in, and there are seats kind of scattered a little bit in the front here. So there's a lot over here.
On each side, there are some seats down front, so please come down and grab them. There's a few here right in the front row. There's a few over here and some up there. Please try to find a seat to comply with the fire codes. All right, hands in the air. Let's start with one. I think that fellow right there.
And who has the mics?
I have the mic.
Oh, there you go. Okay.
And what we're going to do is I'll try to direct it to the next person, so we'll do these 2 at a time.
Hey, how you doing, Senator?
Very good. Thank you.
What I got to say is I'm for healthcare reform, but I think the very first thing that it has to start with, the very first line in it has to be tort reform. We have to have tort reform before we do anything else. Hold on, I only got 2 minutes, guys. Okay.
You're burning up your time.
Now, with that being said, with all due respect, I know that you're a politician. This makes you 3 things. It makes you a liar. It makes you a thief.
All right.
And we know that you're a lapdog for the DNC.
All right, rule number 3, please.
Now that I'm being courteous, with all due respect. Okay?
I'll respond to that.
My question is, why don't you man up and say, you're the 60th vote, right?
Well, hold on, one at a time, please.
You're the 60th vote. So do something for Alaska. We know that you're going to vote for whatever comes down. Do something for Alaska. Say no until you give us back our mineral rights. We know you'll vote for it.
All right.
Do something for us so we can drill anymore.
All right. Healthcare reform.
Yeah, Senator. Let me.
Hold on, Senator. Okay, we have a fellow here in green.
Well, let me.
Please. He's next. I'm just getting.
He's just lining them up. Just relax. Don't worry. Everyone gets a shot. First up, we can have a discussion on ANWR and all those other issues, but let me first talk about tort reform. The issue around tort reform, the President has made it very clear that, let me,
hold on.
You know, if you want me to answer the question, I'm happy to do it, because that's what we're here to do. Attempt to have a civil discussion on the issues. That's what I think to do. So, the President has made very clear that he has already directed the Health and Human Services Department to do demonstration projects on tort reform. And now here's the issue on tort reform. Some of you may or may not know this. Tort reform happened here in 1997, in the last legislature. Now, I don't know about you, but my premiums didn't go down. The actual cost for medical delivery didn't go down. So one of the things is the idea that the President has, which I agree with, he wants to do demonstration projects to see what works and what doesn't in tort reform. And that's what he's already directed, not waiting for a health care bill. And they're moving forward. So the broader issue, and you know, you have your opinions of me, that's your opinion. I don't have really a response to that, but I will respond to your question. It doesn't mean you get another shot at the question. And that is, there are times when I'm going to agree with the President, and there's times when I don't agree. I can go through the list if you'd like, and I can go through the list if you'd like.
Respectful, please.
I mean, just today is an example. When you get home tonight, turn on the news, watch it. When the president disagreed with my position as well as Lisa Murkowski's on the Territorial Guard and making sure they have a pension that they justly deserve, that the Army took away from them, 26 people who are 80 plus years old who serve this country, and that is one example. Most recently on OCS, I disagree with the president. I go through a shotgun. On all the gun issues, I disagree with him on. We can go through the list, but because I don't necessarily agree with your, excuse me, sir, just because I don't agree with your position, doesn't mean I'm not listening and that I'm not representing Alaska. It's a very diverse state here, and I hear from everybody. Thank you.
Okay, we have a fellow here in green, and I want to come down. There's a lady right there in green again, right by the aisle.
Good evening. Let me first say that I'm not really happy to be here, and I'm not seeking a searchlight or spotlight and don't want to be on the radio, but such is life when you have a 3-year-old and you care about the state of your nation. Let's start with your graph, sir. It wasn't my original plan, but I didn't learn much in college, but I learned one thing. There's lies, there's damn lies, and there's statistics. You can make those graphs look however you want. You can project numbers out for as long as you want, and it doesn't really mean much. At any rate, I proudly served this great nation for nearly 8 years in the U.S. Army. And please look. Please let me say that I feel strongly that our representatives are badly mishandling our rights to freedom and protection of our Constitution. There's an underlying issue that I think most Alaskans have. There's an underlying trust issue that I think most Alaskans have with the way that you and your staff are representing our principles and interests. I'll get to more on that later. Not just you either. I think it goes past that. I'm taking time to, I'm going to skip past your opinion on public option, where it appears to be that you're waving in support of public option. But anyway, for starters, since when did health care insurance mean that citizens shouldn't pay out-of-pocket expenses for health care, for basic health care, not for emergency health care? And stop telling me that every family has to pay $1,900 a year in the hidden fees in order to cover the cost of caring for the sick who don't have health care insurance. Common sense tells me that if my family's paying to have others get treatment who don't already hold insurance, they're getting treatment. This argument started with them not being able to get treatment. So don't pretend on one hand that underprivileged people can't get care, and then on the other tell me how much it costs. And stop pulling numbers. Stop pulling numbers out of thin air. Stop projecting how much it's going to cost 30 years from now, when you don't even know what the GDP is going to be this year, nonetheless next year, or in 2039. You don't know what the GDP is. You can't say it's going to be 34% of GDP.
I need to ask you to wrap it up.
I'll send the rest of this to you in email. I'd like a personalized response from you. I'm tired of dealing with the staff weenies who hang up on me and who don't pass my information on to you. I'd like a personalized reply to you.
All right, Senator Begich. Okay, hold on now. Let's give him a chance. Senator Begich.
Let me, first off, we can argue over statistics of the future. I'll just give you statistics of the past. 1997 to now, 1997 average health care premium in this state was $6,000. Now it's $12,000. So you can argue it's all going to be flat for the next 10 years. I'm giving you a statistic that exists. That statistic doesn't lie, sir. That's exactly what it is. So let me put that one aside. Second, the issue on the $1,900 is very simple, and that is, yes, the struggle is trying to figure out the uninsured, but the problem is right now, when you wait to get service in the emergency room as your primary care, the costs are enormous, enormous. So yeah, they get care and they get it at the wrong time, and the wrong time means you pay for it. We pay for it. Everyone pays for it at some point. The objective of healthcare reform is try to figure out how we deal with the uninsured so they're not having this last-minute cost factor that is expensive medicine. And that's a fact. Matter of fact, we have a great example. I mean, you who serve in the military VA, we can argue there's problems with it, but generally they provide millions of coverage. Millions. I pay for that for my taxes. I'm proud to pay for it. I'm proud to pay. I know my father-in-law's here, he's a retired colonel, somewhere in this audience. I'm proud to pay for that. And I do. That's right. But the point is, the $1,900, you're going to pay it sooner or later. And I'd rather have that person working on being more preventive and healthier instead of the last minute emergency room. But that's where the cost is.
Okay, let's do another one. We have a woman here with the green right there by the aisle.
Hi, Senator Begich. I think you're doing a great job, and thank you for coming.
All right, it's time to every time,
And I wish everybody would just be factual and not emotional. I just retired from being
Respectful, please.
I just retired from being a nurse for 40 years, and the last 29 of them were here in Alaska and in the emergency room. And I can tell you, I've seen a lot of different types of problems with costs over the years. And I specialize in a type of nursing that requires specific equipment. And if we don't change soon, and if we don't change after we do some of this type of stuff, if we don't change the reasons that the costs have gone up, such as the people that provide the medical equipment, the pharmaceuticals, and of course keep the insurance down. There's a lot of reasons why the cost has gone up, and stop having all these for-profit places available. I think there's a lot of things that can be done, but I do appreciate what you have here. And I do think preventative medication, preventative medicine is a big key to this. I worked in emergency rooms. I worked at Providence for 6 years. And you will not believe how many people use that as their health care. And we all pay for that. I don't care what you think. You need to learn the truth about this information. And there are a lot of people that have no insurance, and a lot of them are people that own businesses. They're people that have the money, but they don't choose to buy insurance. And so then the hospitals will take a lump sum from them, and they pay much less. There's a lot of different variations on this, you guys. And that's it. And that's my question. Thank you very much.
Let me make just a comment, and then I'll leave it at that. And that is, thanks for your service as a nurse. One of the things that this bill and the other bills are talking about, everyone agrees on this. I don't care if you're Republican or Democrat. In the Senate, they agree on this, and that is there has to be a much higher focus on prevention and wellness and a focus on that early stage, because that is the area that we can have greatest impact. For example, in the Medicaid expenses for this state, 82% approximately is dedicated to people who have chronic illness, preventable disease. And if we spend more effort focused on wellness, areas of prevention, the end result is there is savings at the back end. Safeway gives a great example, the Safeway Corporation. And this is from them, fact. Safeway Corporation. They know they can calculate a person who's overweight will be seeing a physician, a doctor, or some sort of medical institute, or be in a medical facility 10 times in a year of their employees. When they are healthy, living a healthy lifestyle, good weight, good blood pressure, 1 time a year. So Safeway has changed their whole way of doing business within healthcare and insurance, and many of those ideas are incorporated in the Baucus bill. And it's focused on the prevention, so they don't end up in the emergency room.
Okay, there's a guy in the very back row, right back there. We're going to try to move these around the room, so just keep raising your arms, and I'm going to keep moving as many as we can.
Thank you, Senator Begich. I'm 36 years old, and I feel for the first time I have a voice in the U.S. Senate, and I'd like to say thank you for that. I would also like to say that I feel that this Baucus bill is a Christmas present to the insurance companies. There needs to be a strong public option. There is no health care reform without a public option.
I think the statement was a question, so I'll answer. Am I right? Okay, I think that was the question. I don't want to stop you if you're not done with your questions. Okay.
Go ahead.
Next Tuesday in the Finance Committee, they'll debate the issue of the public option. Here's where I am, and I've said it, and I know someone believes that I'm wavering. I'm going to go, I'm not a single payer. I've said that over and over again, so people who like single payer, sorry. People who hate single payer, fine. But I don't have any interest in single payer. The issue with the insurance companies, we have to have a mechanism. have to have a mechanism within the system that ensures that we have cost control on insurance companies. Here's why. If you go, and I'm not necessarily a supporter of the idea of mandatory, but if you deliver 40 plus million customers to the insurance industry, there has to be a mechanism to ensure that people do not end up paying a huge cost because now they control the market. The exchange idea that's being kicked around is a very innovative idea. Exchange, co-op, there's a variety of variations. Where that ends up is hard to say. If I had my druthers, and I've made it very clear last Thursday in our Democratic caucus, the program that I belong to, I'd just open it up and let people buy into it. If they want to pay the full premium, go ahead. I don't know. I would be frank with you, for those that work for state government or municipal government anywhere in this state, this program is less quality. But if it's opened up, and the reason why I don't mind doing that is because we have 3 million plus customers in there, plus dependents, gets it up to close to 8 million people. It's not a bad program. Individual, if they bought and paid the full premium, it's $460. A family, it's $800. Employer shares part of that, it lowers it. Doesn't cost less than one dime, not one dime, because it just opens it up. And what's unique about it? It's an insurance competitive pool. They're insurance companies that compete for the lowest cost and best program for us as a group. That's what it is.
Okay, I want to ask this
And
lady.
yes, I would be happy to say they should compete across state lines. Absolutely. Absolutely. And I have said that, and I support it.
Lady in the turquoise sweater here in front, and then we'll move around.
Well, let me, if I can, just because it's a good question. This is a very good question. And let me answer that. Surprisingly, it's a mixed bipartisan group that's posted. Here's one of the arguments. States' rights, which is a very important argument, especially in this state. And the argument is, well, then you take away the right of a state to potentially regulate them as an individual state. Very valid argument. Here's my pitch to it. Here's my idea. I said, okay, do this then. Set a standard. If you want to be in the national insurance program, in other words, you're an insurance company, you want to offer a program to Florida and Alaska and California, we'll have standards that you have to have for capitalization, what kind of cash reserves you have to have, kind of a list. But each state regulatory agency will regulate them on those standards. So they still get their state's rights, but we have some basic standards. It's how I bought a house in Washington, D.C. I did my banking here in Alaska. So I want to do business here, and I could do it. So I agree, cross state, do it. And there's a mixed bag, but there's a group of us, Claire McCaskill, I can tell you who they are. There are people like Claire McCaskill, Ben Nelson, myself, Mary Landry on the Democratic side that are very interested in this idea. And Ben Nelson's a former insurance regulator, so he understands how to kind of craft it. So we're working on an idea. Finance committee hasn't accepted it, but we'll work it from the floor.
Okay, let's get into a question down here in the turquoise sweater.
Okay, hi. First of all, I want to thank you for holding this forum, and I hope it remains as civil as it's been. I'm fortunate enough to have access to one of the best government-run healthcare systems in the country, which is the VA. I'm an 8-year veteran of the U.S. Navy, and therefore my healthcare is on the other hand, I'm self-employed, and my son owns a business with less than 10 employees. For someone like my son, without a private option, which would cover his employees without him having to expend his capital to cover them, which he can't offer it now because it's unaffordable, without a public option, how would the insurance companies be forced to lower their premiums and make them available to people to stop dropping people when they become sick? And I can befuddle here, but there was something on the floor speaking about taxing employers who don't provide health care and coverage for their employees. As a small business owner, it would be impossible for my son to cover his employees.
Right. Let me, you got kind of three in there, I'll kind of do it rapidly here. First, the employee cost. This is a proposal that the two committees are kicking around. One has already done it, and that is if you have an employee that is receiving a subsidized program, meaning Medicaid, then as an employer, if you don't offer insurance, then there's a fee. Now, I made it very clear, I don't support that. There's two reasons. One, the employer may not then hire those people, on Medicaid. The second piece is, it's not fair that a business gets penalized. They need to figure out how to provide health care if they can. That's one issue. The second one is on the small business piece. If I can expand a little bit on this idea that I said open up the federal program, I would open it up and the main focus would be small business. I can tell you, and I just noticed my brother-in-law and father-in-law here, and it just reminded me that my other brother-in-law has catastrophic $15,000 deductible, and he pays about $470 a month. He's basically waiting to end up in the hospital. As a small business person, if you can open up the federal health care program that's private insurance, that's competitive, and you say to an employer, especially small business, you go ahead and buy into it. And you pay the premium, you work it out with your employee, but also on top of that, we're going to give you a tax credit. And I proposed a $1,000 tax credit for individual and $2,000 for family for every small business that provides that. And they buy it out of our pool because there's no cost to us on that end. And yet, access is the biggest problem for small business because the pools are too small. If you got 10 employees, there's no way, when you deal with an insurance company, it's tough for them to place you in the marketplace. But if you're now in a pool of 3 million, suddenly the opportunity to be placed is much easier. And the cost then reflect that. That's how I would approach it.
Okay, I want to go way up in the back, the guy in the red shirt up there, and then I'm going to come down in front here, the lady in the light blue.
I would say as I get up there with the mic, the VA question you asked too, there's about 1.2, 1.6 million veterans across this country that have not signed up for their VA benefits, which is amazing. I mean, it's available, and you know we're doing some things with the budget of the VA to help get that message out to them. They should sign up and get those benefits. Almost 1.6 million veterans do not access the VA, which I don't get that, but.
Marine Corps vet here, I just want to know, there's about 1,000 examples of how government gets involved in some things, and all the good intentions that they're paved with, they end up just going bankrupt. Social Security being the biggest one. Can you give any assurances that you personally, as the Senator for Alaska, will stand up and assure that that will not happen?
Well, I will tell you, yes, I'll tell you this. And I actually had this conversation when I came off the plane about 3 hours ago, and the gentleman stopped me, and he was from Fairbanks, and he had a very similar comment, and he says, government doesn't run anything right. And I said, well, I'm glad I landed with the air traffic controllers, because I was feeling pretty good when they guided me down to the plane. Now, saying that, there are things in the sense of this bill that is important, and you're absolutely right on how to control the cost. Medicare has serious problems that have to be addressed. With this program, one of the things I've driven home, for example, when they came up with the co-op and they kicked that around, one of the things I've said about the co-op is it cannot have any mechanism, not one mechanism, that the government comes in and deals with it if something happens to it. They have to be privately insured to back it up through the bond markets. We are not the backup, the backstop for it. I've made that very clear. It has to stand on its own, and it has to stand on its own with its own premiums, its own members, if that's what we end up doing, because the idea is to shield it from touching us in the general government. That's been my pitch from the very get-go. And so to assure you, that's what I'm pitching for, and that's what I'm arguing for.
Okay, I want to have this lady in the light blue down here, and then there's a guy in a black shirt way up in the middle of the pack up there.
President Obama, in his speech before Congress the other night, stated, 1, no public funds would be used to fund abortions, 2, there would be no tax increases, and 3, no illegal aliens would be covered. A side-by-side comparison of the health bills done by the Kaiser Family Foundation shows that 1, Senator Baucus's bill will require at least one plan to provide coverage for abortions beyond those which federal funds already permit. 2, Baucus's plan states the largest source of new revenue will come from excise tax on high-cost insurance. Additionally, Representative John Conyers' plan, H.R. 676, calls for increased income tax on the top 5% of earners and institutes a modest and progressive payroll tax and imposes a tax on stocks and bonds transactions. 3, H.R. 3200 and the Senate Health Bill requires all individuals to have health insurance, no mention of individuals being citizens or illegal aliens. My question to you is, Do you intend to read the bill before you vote on it? And do you intend...
Okay, let her finish.
Do you intend to vote for any health reform bill that includes any of these stipulations, funding abortions, tax increases, and covering illegal aliens? Thank you.
Let me, first I'd like to respond to the reading of the bill, and I hear this all the time, and you know, some of you are not going to believe it, some of you will believe it, but you just take it as you want, is my attitude, and that is, for example, the stimulus bill. I read that bill. I'll be, you know what, like I said, some of you will believe it. You can come in and see the archives, and you can go see, you can see the archives in there. And I will tell you, the health bill, which the chairman's mark, which I've been, I got plenty of plane ride, and I sit here and I go through it, I make my notes, and I make comments on it. First off, on the legal alien piece of it, I'll be happy to pull out the section out of the bill here for you. It clearly states no. On the abortion issue, on federal funding, I'll be happy to share it. You can go also to the web, if you want to, just, I'll answer the question. I won't answer 17 at once. She asked the question, so I'm responding. And that is, if you go to the Finance Committee's website, you can get this. It's called the Chairman's Mark. It explains the elements of the bill. It goes through it section by section, item by item, and on the illegal alien issue, as well as the abortion issue, it is very, very clear. And I support that. I have no problem with that. The third issue on the taxes, the Conyers bill, maybe they're looking at it seriously over there. It's not being looked at in the Senate side that way. That is not being discussed. What's being discussed is some of the issues you've talked about, and I have made my concerns very clear in regards to premium surcharge. And that's what basically excise tax surcharge, everyone has different names for it, but it's basically for certain premiums that are of higher cost, 25,000 in the latest discussion, anything over that there'll be a surcharge on. I've made it very clear that I'm not supportive of these. I don't know where it's going to end up, to be very frank with you, because there's great argument on this, and it has not been decided by the Finance Committee. It's in his chairman's mark, but I can tell you what's in his mark doesn't mean what you end up with.
Okay, in the back, and then we're going to come down to the guy in the front row here. In the back, please.
Yes, my questions revolve around what I have seen and experienced. I'm a contractor. I work with the Medicaid waiver program. I saw a lady a few years ago, a year and a half ago, wait 6.5 months until she died trying to get a shower because the government couldn't make a decision. They only had 2 beds, so they requested over 7. And because the government, with the Medicaid waiver program, couldn't make a decision, she ultimately passed away. The second one is here in town, in Anchorage, where another agency was willing to fund a walk-in bathtub so this woman, who was a veteran, 90 years old, could get in her tub and lower herself into hot water so she could bathe and relieve her ailments. Medicaid waiver had a very small portion of that, opening up a door so she could get from her bed to her toilet. The government's inconstancy. Medicaid waiver refused to participate. The lady had a massive heart attack waiting to try to have a tub so she could bathe. Why would I think for one moment a government-ran health program would be any different? And my last comment before I sat down, are these numbers as good as the numbers the citizens of Anchorage got in 2009, January 2009? Can we count on these numbers?
All right, healthcare.
Let me, I hear, from people at different times, and yours is an example of problems with the system. There's no question there's issues. And we hear in the VA, we're working through some issues on the VA, but the discussion on the Senate side, and I'll try to say it again, the public option is heavily debated on the House side. The Senate side is more around exchanges and co-ops and ideas that are privately run. So I can't answer your question other than say that's the answer. I understand what you're saying, but I will tell you for the millions that receive Medicare, Medicaid, VA, Indian Health Services, there's an enormous amount of positive delivery of services. Are there issues? Yes, there are. But generally, when you're dealing with millions of people you're delivering services to, and you have some issues that pop up, that's going to happen. And I hate to say it, I'm just being blunt with you. But the delivery to so many others is high quality.
Okay, the fellow in the front, I'm going to go over here to the woman in black here.
I'm over 20 years in the Air Force. I can't get to the VA. I'm priority 9. You only fund maybe priority 2 or 3. That's the problem. Money. You guys don't back it up. You talk about it, you don't back it up. But I got a question for you. Why can't we just take, instead of going through that stack of papers you got, just throw that away, why don't you just put a one-pager out saying every American can sign up for the U.S. Senate health plan? It already exists. It already exists. We can shop for what we want. We can go across state lines because it'll be a nationwide thing. And it works great for you guys, so it must work great for us. Why not just do a one-liner, say, every American is in the U.S. Senate health plan?
Well, let me, that's what it said. Unless someone missed that, the federal program which I belong to, with my federal employees, there's no special program for the same, so get that out of your mind, for anyone that thinks that. I get the same program that every federal employee does, and I agree with you. That's what I have said. I thought more than once tonight. Second thing is, the federal program does not allow you to compete across state lines. That's a problem. And this gentleman over here and another gentleman over here, I think that should be changed. And that's exactly what I have said. I'm one of 100, and this is my pitch on this. I made a strong pitch Thursday in caucus. No, you can't. Here's how
okay, one at a time.
Answer this question, because here's how it works. I know this. Just recently I became a federal employee. I know this. Here's how it works. You get this book. First off, it's a very complicated book. For any federal employee in here, it's a book about yay thick. Then you have to find your state. Now let me finish. So you find your state. And then there's a couple insurance companies that compete in your state, and that's who you select from. I don't get to select from who's competing in Washington State, or Oregon, or Florida. I wish I could, because I like some of their rates. But I think the line should be erased, and I have no problem with what you just said. The second thing is on the VA. I just got here in the Senate, and one thing we did, 2 things, actually several, but 2 major things. The President's budget, he's added, and we have supported, $25 billion to the VA, the largest single increase in its history. And adding priority 8 to the list, and making sure we do it on a 2-year budgeting cycle. And the reason for that is, here's what happens. Out of the last 21 VA budgets, 19 didn't get passed on time. So here's what happens. The VA needs to hire a nurse. Well, guess what? They can't hire a nurse because the budget hasn't been approved. So they got to wait. Then we get these crazy things they love to do in Washington, D.C. called continuing resolutions. What does that mean? They don't do anything. They just continue to kind of go where they're going. So they don't hire. So they don't hire, they don't get people in the system. So the 2-year budget, which the President has supported, the Senate has passed it, the House will support it, will give the VA the resources faster, and they'll have it for longer periods of time, which means they can hire and plan longer out. That is absolutely what I heard during the election, and absolutely what we brought to the Senate. So I hear what you're saying. Should we get the priority 9? Absolutely. Absolutely. Every veteran should be covered by the VA. And it shouldn't be us figuring out that we don't have $1 billion or not $1 billion. The VA and the veterans that serve this country deserve every dime, and everything's coming to them. And that's it. That's what I'm saying.
Okay, I want to go to the woman here in black.
Where'd you point to, Steve?
Right here.
Oh.
Thank you, Senator. I have read and studied House Bill 3200. and read portions of the Baucus bill. I've done my research. A sampling of some of the things I've learned are as follows. One, the U.S. has the highest cancer survival rate in the world. That the new president of the Canadian Medical Association has said that Canada's medical system is, quote, imploding. That the median wait time for Canadians seeking surgical or other therapeutic treatment is 17.3 weeks. And that the waiting time for surgery for scoliosis in the UK is 8 months. Is this really a road we want to go down? The president has said that he will cut Medicare by $500 billion over the next 10 years. But in just 2 short years, the baby boomers start moving in. That's 76 million people, 1/4 of our population, and they're going to cut the budget for them. Medicare is already scheduled to go bankrupt in 9 years. Proponents of this legislation simply do not have the math on their side. House Bill 3200 provides that the HHS Secretary Kathleen Sebelius will name 3 medical conditions for which she will limit hospital readmissions to Medicare recipients. 1 year later, she'll add 4 more conditions to that list.
30 seconds, please.
Whether or not a person can be admitted or readmitted into the hospital should be decided by the doctor and the patient solely, and not by the government. Here's my question. How do I opt out of Medicaid, or can I? How many doctors have you consulted from the Alaska area regarding the health care plan, and what were those specialties? Will you support an amendment regarding any bill that requires that it be posted to the website for 72 hours before it goes to the floor for a vote?
Okay, we're going to have to wrap it up, please.
I'll try to wrap it in 5.
3 questions.
Yes, I have no problem in posting the bill. I think it's great. If you all want to spend time reading it, great. No problem. And I've actually committed to reading the bill and seeing it posted. Second, just last week I met with over 100 doctors from both public health, right here, in this town, right here. From public health to private health. So at one moment, there was a great debate between them all, because one said something about public health, and the other one jumped on him, and I decided to watch and listen, and everything from nurses to physician assistants, and a variety of specialists were in this room. Prior to that, I have done several other smaller groups around the state when I've met with folks, and have done video conference, teleconference, but literally last week, 100. The third one was opt out of Medicare. I don't know what I can say to that, to be honest with you.
I don't think I
I'm just giving you my honest answer. I really haven't thought about it.
No. How can you determine
okay.
what health care is going to be and tell me I can't get out?
No. You had 2 questions there. One was, can you opt out of Medicare? I haven't really thought about that. The other part of that question was, in that earlier segment, that you talked about the panels and all that stuff. That's on the House side. That's not being discussed on the Senate side. Well, you talked about panels. You talked about the decision should be made with your doctor and readmittance. I agree with you on that. Your doctor and your family should make that determination together, not some panel. I agree with you on that.
Okay, I know a lot of you are starting to get sore arms, and I'm going to do my best to get to as many as possible. There's a lady way back up there in the blue who's been happy, and I know a couple of you down here have really been persistent, so you're next.
Steve, I want to see the lady in the blue.
Up there in the...
Oh, okay. And will folks please raise your hand if you have a seat next to you or seats in your aisle, because people are looking for seats.
Down here in the front, there's
if
definitely...
you could raise your hand, because folks are trying to get in.
You guys have been working out, the ones of you that are holding your arms in the air the whole night.
Okay, so this
Good
is
for
a seat
you.
hand. If you have your hand up right now, there's seats next to you? Okay, there's lots of seats.
Yeah.
So thank you. Okay, now for the next question.
Come on in, we need to have people in chairs. Go ahead.
Senator Begich, I want to thank you for the opportunity to speak to you and be assured that you're going to be listening. I think a lot of loss of health insurance is connected to loss of employment, or it's due to significant costs to employers who have to, for whatever reasons, opt out to provide insurance. It appears that the reform health care will have significant costs related to it. more than likely the cost will be funded by increased tax dollars. Tax dollars are paid by employed citizens. It seems more prudent, logical, and imminent that we as a nation concentrate on improving the economy and making sure that the economy is thriving in such a way that at least, at the very minimum, 95% of employable citizens are able to work. And how I connect that to the health care reform package is that I think we're biting off more than we can chew at this time. I'm significantly concerned that we are going into significant debt beyond what we can even fathom. So for me, and I think I'm not speaking alone for just myself, one, it would be better to focus on putting people back to work so that they have the money to pay the taxes and pay the costs that are involved with health care. Two, if we are going to go with health care, that we focus on the segment that our parents really need. And I know you are a parent, and you work so hard to make things happen for our children. So why not work on providing care to our children, who are the future of our nation, both their preventative and their chronic health care. And lastly, when you talk about preventative health care, we need to take into account that even though you give me dollars to go exercise and you give me dollars to go get insurance, I still have unhealthy habits in terms of eating, etc. And if I don't have a job, I'm going to buy what I can to feed my family, and it is not necessarily healthy. And lastly, I am pleased to know that you are not going to support tax dollars going to abortion, because that does not promote life.
Okay, I need to
and very quickly, the last point too, that is current law, and no one's planning to change it on regards to the abortion funding issue. But your concern on the economy, the health care, the economy, it's all complex in a lot of ways. They're all interconnected. Your point is well taken, and that is, you have to kind of get the economy moving in the right direction, and there's mixed views, but I'll tell you, compared to January to today, the economy is way better. Now there's mixed views, there's no question about it. But when you look at the data points that we see on a regular basis, there's a change that's starting to occur. Now we still got a fragile economy, and so we have to do everything we can to keep growing this economy as much as we can. The problem is with healthcare, it's one of the biggest drivers of consuming the dollars that you all have available for driving this economy. As healthcare continues, and the gentleman earlier disagreed with my data points, okay, I'll just use what's existing today. 18% of our gross national, or GDP, is consumed by healthcare costs. And as it gets more expensive, here's what happens. It's a vicious cycle. The cost to deliver to all the veterans that are here gets more expensive because it's a medical coverage program. Medicare, Medicaid, Indian Health Service. So you have to get it at two ends. One, growing the economy and deal with this big piece of the puzzle. Because if you don't on this healthcare cost, it will drive and drag this economy down no matter how hard we work on this side. Now, putting that aside, I think there is sentiment among some members, including myself, that there is this effort to try to, there's a pent-up effort of people who've been there in DC for a long time that let's do it all, get it all done, pull the trigger, and be done. My view is, be careful what you ask for, walk carefully, and let's step into it. There's things you can do. For example, the S-chip, which Denali Kid Care in this state has provided an enormous amount of care for our young people in the state. If we did not have that, the healthcare costs would increase, no question. The average cost to deliver that is $91 per month. It's a great investment for our kids, because the net result is they're healthier, living better, and means cost down the road. So when you think of S-chip, good investment. The VA, making sure it's fully funded, as this gentleman has brought up. There are elements we can do, and I know there's some in our caucus as well as on the Republican side that discuss this big picture. Sometimes you got to kind of pull back a little bit, and that's going to be discussed. I have a simplistic view of this, as I mentioned, in regards to opening up our federal program, dealing with the reimbursements on Medicare, making sure that's a fair reimbursement so doctors can compete. Also making sure that we have primary care doctors actually going into the field, because less and less are going in that field. Less and less going in that field, what does that mean? Less and less doctors, which means competition is tighter, which means pricing changes. So it's a combo. And so I agree with you, the economy has to be always kind of the number one, but healthcare is this drag. It's kind of, as you move, it drags you a little bit. and it will drag us more significantly. We can argue over the numbers. I believe it will be more significant. Some don't believe that, but I think it is significant. So I hear you, and we've done a couple things, and some people agree or disagree in this room. I mean, I know some people don't necessarily agree with the stimulus program, may not agree with the cash for clunkers, but I'll tell you something. You ask the auto dealers in this town and across the state, the cash for clunkers moved cars, made a difference, employed and a multiplier effect, they estimate 4 to 7 in the economy, which is not bad.
All right, but healthcare. All right, nice lady over here in the dark sweater has been waiting patiently, and she's going to defer to her friend sitting next to her, so take that one, please. And I'll just remind you all, somebody down here in the middle's busted, the cell phone went off. If you have a cell phone that's turned on, please switch it off, and we'll go ahead. Go ahead.
It's not like we don't get fined or anything.
I mean, we can do that.
All right, I want to thank you for taking my questions, and I do have a couple questions and a couple of comments. First of all, I'd like to ask the question as to why are people forced to have Medicare as their primary payer when they get to that age? That makes absolutely no sense to me whatsoever. And I work for a durable medical equipment company here in Anchorage. We provide services for things that people are going to use in their homes. When we have to wind up billing it to Medicare, it winds up costing more than if we were billing it to their primary insurance, or private insurance. Let's see here. I also want to know if this law, if whichever bill passes, will Alaska Natives be required to take this insurance as their primary insurance? Will they lose their Indian health services?
Those are your two questions?
I'm sorry.
Okay, I don't want to stop. I'm writing down.
I was also listening to TV the other night, and they were talking about passing the bill on concepts, not actually having the bill written out, but conceptually passing a bill. How does that work? I don't understand that whatsoever. And my last comment is, Senator, I would really like to see you be a maverick for our state and for our nation. What I'm referring to here is step up to the plate, pay into the Social Security and Medicare, and then take that when it comes your time. Don't allow yourself and your colleagues to have special privileges. We voted you guys into that position that you're in, and I don't think we voted y'all in to become rich. And the way it looks to us who are paying for what you guys are living on, it's not right. It's just not right at all.
Very quickly.
Okay, your benefits with your insurance is changing, and it's changing rapidly because the Federal Blue Cross program is following Medicare guidelines. If you think you've got it sweet, just wait, because it's changing. We are experiencing it every day where I work. You're losing your benefits.
Okay, time's up. We've got to get some more in here.
Well, you made my point by your last statement, and that is, first off, I pay in the Medicare. I pay in the Social Security. I pay taxes just like everyone else. There's this theory, and I know some of the radio guys like to believe this, and that is somehow we got this special little program. We don't have to pay in the Social Security, we don't have to pay in the Medicare. We got a special health care program that people drive us some chauffeurs to the hospital or something. We will be subject, as these benefits you described, you betcha my benefits are going to go down.
Hold on.
Let me finish. The issue that you brought up is on the other four things that you brought up. First off, on concept. Here's in the Health Committee, Health, Education, Labor, and Pension on the Senate side, they actually do it by statute. In other words, it's written out as you would see it in the law. Then they do amendments to that process. The Finance Committee, this is how they've always operated. They do it in great detail, and this is what I have here. They call it a concept document. There's two stages. First, it's kind of an outline concept, and then it's an in-depth concept. And then once they work through the amendment process, then it's put into a legal form. There's no concept we vote on. We actually will vote on a statute that is going to have the legal descriptions of every item that is being looked at. Every section, it will have sections, it will have subsections, it will have A, B, you name it. That's what you vote on. So the Finance Committee, that's where the confusion is. The Finance Committee has a concept or it's kind of a very detailed concept, but They then amend toward that, and then the writers write the language, and then it's reviewed again. That's how they do. They do different than the other committee. That's just the way they've done it for years. So, in regards to Indian Healthcare Services will stay exactly the way they are today. That's what they will be just as it is today. There's no change. Because I want to get to your first question. I agree with you. Medicare should not be a primary care payer. And here's why that was done for all of you folks. Back in the 60s, who was the most cost part of healthcare? People older than 65. So insurance companies figured this out, and they said, hey, why don't we have the federal government and make them the primary payer? That's exactly what happened. And I agree with you. This is one of my points too. I think it should be. If you have, for example, I'm under the retirement program from when I worked at the city. So here's what happens. When I'm 65, I got to make Medicare primary. I got another better program. I'd rather have that as my primary. And I agree with you. And that's one of the debate issues in these 500 plus amendments. And that's the process we're going through. So your point, during my campaign, I talked specifically about that. And it was a scheme that was done to take off the most expensive and make the government pay for it. They cream the crop. They take the top.
Okay, the fellow over here in the white shirt has been very patient. Listen, you guys must be in pretty good preventive health condition. You're holding on to nerves real well. So hang in there. We're gonna keep doing this.
Good evening, Senator Begich, Captain Dan Maynard, United States Army, two-time combat veteran. And I don't think the healthcare debate is really about me. My wife's a state employee. I'm in the Army, so we practice preventative medicine. So we're healthy, and we can afford to pay the co-pays and deductibles. And luckily, we don't have to pay any of that. And I also want to thank you for your past and current support of the United States military service. My story is this. My mother's 54 years old. She's a conservative Christian. She works her butt off every day, but she barely makes ends meet. Her paychecks rarely cover the basics: rent, food, gas, auto, and life insurance. Her prescription drugs requirements are not built in her budget and are clearly unaffordable. Americans should not have to decide between rent or auto insurance or life insurance and health care. And in my opinion, I think where we are losing this debate is it hasn't been clearly articulated to folks how we're going to do this. And I agree with the gentleman down there. It may not necessarily be your health care plan, but it has to be some type, it has to be articulated in a condensed format so hardworking people like my mother can understand it. So my question to you is, how can you articulate, and how do you guys plan on articulating to people like my mother how you can fix the soaring cost of health care and prescription drugs while debunking the insane myths about health care from the extreme right?
Let me, let him finish, please.
And lastly, what is your opinion on the increased level of disrespect being shown to the office of the presidency?
Well, let me answer, I'm not sure I want to comment on the president because we're here about health care, but I think, we respect the office, that's what we should do, pure and simple. But I'll leave it at that. In regards to the simplicity of how to explain this, you're absolutely right. It is confusing. It is convoluted. I can go through a list of descriptive words. And a lot of it's because, we live in a different media cycle now than ever before. I mean, I actually joke. There was a moment, the press out of Senator Bachus's office, they line up, literally from that wall to that wall, just lined up, waiting for the white smoke to rise and you come out and say something. So I turned to one of my staff people as I was walking by, I said, hey, why don't I go in there, have some papers in my hand, go in for a second or two, then come out kind of upset, playing around for a little bit. And I guarantee you, in 1 hour, probably 20 minutes, it will be on every newscast. Senator Begich comes out of Bachus's office screaming and angry about what he did. That's how fast the news cycle is. So what happens is, no matter what you say or you kind of lay something out as just a concept, before you know it, it's now the policy. And it's now in the public arena, and then the public arena kind of chews it up.
Wait, Senator, I want to ask you, did you do that?
Thank God I had some good staff people that, but
All right, go ahead.
So, But I mean, that's one of the drawbacks with trying to deliver what we're trying to do. And I think my point Thursday to the caucus was just that. The public doesn't understand any element of this, and when they do, there's elements they really solidly agree with, and there's issues they really don't like. And what we have to do is simplify this. And actually, here's exactly, and I'll use my wife's quote. She said, she's in retail, she's in the marketing. She said, you know, you gotta just have the KISS program. And I said, and I looked at it, I knew what that meant, but then she says, keep it simple, senators. And I appreciate it, but I mean, she is exactly right. And we have not been able to do that. And I think that is a failing on our part, because we have not been able to simplify this, and I think it's because, in a way, this woman way up here had asked that question. We're trying to do everything all at once. And because of that, it gets confusing, and even among the members. And that's why literally Thursday was a robust, I will say, Democrat caucus meeting that I think a lot of views were finally put on the table from people who are not part of the committee structure. So I agree with you. And you know, my mother, you know, she's a Medicare recipient, and she, you know, just like a good mother, she calls me. My father-in-law, when I was here last week having dinner, he gave me his 2 bits, but it is confusing, and we have to simplify it. If we can't, we have failed. I agree with you.
Okay, I have one in the very back row in the maroon shirt, and then this lady down here in the white sweater, and we're going to go to one back there after that. And we're going to keep at this. Please be brief, and let's see how many we can get into this.
Some of you I can't see only because these lights are gleaming, so I think I see you by the exit sign. Is that right? Very good. Okay.
Okay, in my opinion, and this is my opinion, I'm sure there's other people who agree with me, our government has no business meddling in health reform at all. With that said, from what I can see, we're going to get this shoved down our throats anyway. And when I get it shoved down my throat, you can bet I'm going to puke it back up. Now, I don't know what the name of this congressman or senator's name is. There is an amendment out there that should be passed by you and all of Congress and Senate that would require you to take the same health care that we do.
Is that your question?
Same health care that the Americans, that you pass and force us on, you should have to take the same thing.
Okay.
Is that what it is?
Yeah, is that your question?
Okay, now, like this lady down here on the left said, stand up and be a maverick. Pass this kind of thing, because in my opinion, you guys are no better than we are. You get your own retirement plan. You get paid after you get out of office. I don't know anybody else here, but if I get fired, I got no paycheck. I'm done. So what I'm asking you, are you going to stand up for Alaskans and try to pass this amendment, or get this amendment passed, that will require you to take the same thing that we do?
Let me first, I don't know about if you're out of office, you get no paycheck. That's the way it works. So I'm just, whatever myth that is, you know. No, they don't. If they've been there long enough, they get a retirement, like everyone else who works a job for a period of time. Is that what you're talking about? Okay, I'll put that off to the side. The second thing is, that Coburn amendment you're talking about, it's in the Baucus bill now. So, no, it's in the bill. I support, I'll try it again. Yes, but I also support to open up the program so you can all have what we have. I think if you're a state employee or you're a lot of, matter of fact, there's a great study I just read, several large corporations have a better plan than what I have. So it's both ways I want it, because I think it's, you know, yeah, if we do something, we should have the same obligation. At the same time, if we have something, you should have the same opportunity. So.
Okay, I'm going to take this lady in the white sweater, unless she's changed her mind by now, and then I'm going to go over there to the corner on that side. Go ahead, please.
Thank you, Senator Begich, for coming for this meeting. In 1960, before I came to live in Alaska in 1967, I worked as a radiotherapy technician in Sydney, Australia. Many of the patients we treated were terminally ill, and when they came in for their daily treatments, they paid what they could afford, $3, $10, or $20. Not long after I arrived in Anchorage, I took out a private medical insurance through Blue Cross, and they later cancelled on me because of a pre-existing condition. That was over 40 years ago, and I'm still kicking. They could have made a lot of money on me, but I wouldn't insure with Blue Cross today for any reason, and I do support a public option. Thank you.
I appreciate your comments. One data point, 2 insurance companies control the market here. It's about 95% of the market. So it's a fairly significant issue. And that's why the gentleman, again, on the state line issue, that's why I think you need to have more competition to create some fairness to the equation. The other thing on pre-existing, I've said it before, I have it up here, I support eliminating pre-existing issues because it is a problem. Well, let's leave it at that. But I should have mentioned earlier, one other piece of this equation to healthcare reform, and I think our Anchorage Neighborhood Health Clinic here has done a superb job in designing a program that creates a sliding scale system for the working poor of our city here. And they've done a great job. And the investment we make in that system is minimal compared to the return that we get out of it. And there's an effort among some of us also to look at that system to make sure we're not neglecting that to the point where the working poor can have some flexibility based on their need and ability to pay.
Okay, we're going up there, and then we're going back down here.
Hi, Senator. This is...
Where am I looking? Oh, over there, okay.
Hi, Senator. I want to talk to you about the long-term care benefit package because a lot of us that need long-term care, however, have to spend down to get on to Medicaid, and I had to lose my job because if I work, I lose my long-term care. Now that there's more problems with, I have never had any problem with government bureaucrats. However, I had big problems with private insurance bureaucrats. Meaning that they wanted to try to cancel me because of my situation. Nobody in this country should ever have to spend down to get their long-term care. My question to you is the health care package is, will it add to the long-term care so people don't have to spend down to Medicaid?
Yeah, thank you very much. Thanks for the question. And that is, in the Senate markup, the Senate Health Committee bill, and the House bills all have elements of long-term care in there, long-term care programs. One in the health bill, the Senate side, is a voluntary system of increasing the capacity. The Senate finance markup is a cafeteria selection. So depending on your need, you can select the efforts and the elements you want. And also there's an effort to expand the Medicaid money flow demonstration project, which for those that this is very specialized, but it's basically the way the federal government sometimes operates, I shouldn't say sometimes, a lot of times, the money is put into these silos. So you might be, for example, a Medicaid recipient, not in your case of Medicare age, but I'll say if you were, that's one silo, then Medicare is one silo. Then if you're a VA, a veteran, and you're all three of those, you have 3 different silos. Then you have to figure out where do I fit in this equation. The idea of the demonstration project, which has been ongoing, is to expand that and keep it going with the person who needs the services. Let the money flow with the person. More efficient, better delivery of services. The spend down issue is one that we are talking about. I don't know where that's going to end up, to be very frank with you, because it is appalling at a point when we come along, and I say we, the government says, geez, we'd love to assist you in this effort, but the savings account that you have that might sustain you with those co-payments and other issues in life to make sure your quality of life, you got to spend it all down before we can touch you. We have to figure out the right balance there, and I think that is going to be a big debate in the Finance Committee. I don't know where that's going to end up, to be very frank at this point, because literally they had 3 days of debate on maybe 50 amendments, so they got a long haul to go still.
Okay, there's a couple of younger people right over here that have been patiently waiting. The young lady in the white shirt.
My name is Amelia Gellerland, and I'm a senior in high school. I'm here to speak out against socialized medicine. A few months ago, I heard a story, and it goes like this. An economics professor had a class that insisted socialism worked and that no one would be poor and no one would be rich. The professor then said, okay, we'll have an experiment in this class on socialism. All grades will be averaged and everyone will receive the same grade, so no one will fail and no one will receive an A. After the first test, the grades were averaged and everyone got a B. The grades only fell and the bickering between students increased. When the third test rolled around, the average was an F. All had failed to their great surprise, and the professor told them that socialism would also ultimately fail because when the reward is great, the effort to succeed is great. But when government takes away the reward, no one will try or want to succeed. The same way will happen with socialized medicine. Because those who are earning more and paying more for socialized medicine are not going to be compensated with good health care. They may very well lose their motivation to earn a good living so they can have good health care, and the socialized medicine scheme will fail. Canada has shown socialized medicine does not work. A friend of mine whose mother lives in Canada had to wait 2 years to get to the doctor to see a doctor for an issue she needed to have attended to. One day, I or one of my family may need to be seen by a physician, and I don't want to be told, well, we're going to have to put you on a waiting list and we'll give you a call after we've seen the other 1,000 people in front of you. I would much rather earn my own money, save my own money, and spend my own money so that I or one of my family can possibly see a highly qualified physician instead of having to hand my hard-earned money over to the government to be spent for me on people I don't even know. In light of the truth illustrated in the story I began with, how will you keep the same thing from happening in socialized medicine?
Let me respond by saying first again, on the Senate side, we are talking kind of a different program in the sense of the exchange idea with insurance companies, the co-op, which is, as I laid out, some of the parameters. So I understand your point. I will tell you an interesting meeting I just had recently with some folks regarding what's going on in Great Britain. They're actually introducing now insurance companies into their marketplace, which is a very interesting experiment they're doing, and they're actually finding success. So the idea, when people have talked in the past about Great Britain and socialized medicine, well, actually they're sort of the reverse a little bit. And so it's lessons like that we have to look at and see what's working and not working. But I can tell you on the Senate side, as I said earlier, I don't support the single payer. I know that makes some people agitated, but it makes other people happy, but whatever. I think that's, if you go to 100%, you get yourself in trouble if you don't have enough competition in the mix.
Okay, I want to go to the lady in the very back row in the turquoise blue shirt.
I know you're pointing somewhere, so I'm looking. Oh, there we go. Okay, thank you.
I would like to answer the question of the young woman that just spoke. I'm the perfect example of the American health care system and why it does not work in private industry. The reason I'm in a wheelchair is because my parents delayed too long in straightening up my congenital problems. By 3, my knees were touching each other, as were my toes. At age 4, they took me to a specialist. He said he should have seen me at 2. Everything from the hips up is a result of State Farm's fraudulent independent medical review. I wanted to let people know who are fighting the fraud and the insurance companies that are representing them. Go to the courthouse, look up Lois Gilbert versus State Farm, and also look up Lois Gilbert versus Dr. David Spurbeck. He was the fraudulent psychologist that they hired to try and fight my medical records that said I was clearly injured in the third car accident. Dr. Spurbeck, claimed that I was a malingerer and I somehow malingered the shoulder surgeon into doing $25,000 worth of unnecessary shoulder surgery. They fought like hell to keep out the records of the shoulder replacement, which happened after the arbitration. If you go by private insurance, you will find that these insurance companies require that you go through arbitration. Arbitration decisions are extremely difficult to overturn, and that's why the insurance companies love them. You have to show fraud 6 ways from Sunday to overturn an arbiter.
30 seconds, please.
Right now, my case is bouncing between the Ninth Circuit Court and the U.S. Circuit Court of Appeals. I have had State Farm in court since 1994 because I do not give up. So if you need to know how to do it yourself, go to the records and see how I did it. Those of you who think that private insurance is the answer, wait until it happens to you.
Okay, I need to ask you to wrap it up, please.
I don't know if there's I don't want to say there's a question, but I think your statement is well heard by some people here, and I appreciate you describing your own personal experience with the process.